Foot and Ankle Wellness Center, and I wanted to talk to you today about the 5 most common running injuries that runners can experience. So, there we go. Alright, before actually we start, I just wanted to tell you what a gorgeous day it is once again here in Phoenix, Arizona. I like to come here a lot just to get away from it and get a little organized, get my head clear, and then come back up and I'm ready to go to serve my Edmonton public. Alright, so let's get started. First thing I wanted to talk to you about was something called iliotibial band syndrome. Okay, IT band syndrome for short. What on earth is an IT band syndrome? Okay, well what it is you've got the iliotibial band right here, which actually is a strip of soft tissue which originates from muscle, starts at your hip, goes all the way to the outside part of your knee here, that little knobby area right there. That's where it attaches. It crosses the knee joint, not completely, but just goes right down to that little bony area here. And then what happens there is you've got stress, you've got pain there from repetitive motion. And runners can experience this if they're doing long strides. So if you're running with a very long stride and you're running fast, you can injure that area. You can become tender. So when patients come into the office and they say, I have pain on the outside part of my knee here, I almost always know that it's due to an IT band syndrome type injury. Okay, and we'll get on later about what we can do to help do certain stretches to help fix that particular area, and for some long-term therapy that we can do. But for now, you need to be aware of what the injuries are first, and then we can talk to you about it in other videos as to what can be done to help you. All right. So the second thing is the runner's knee. Okay, sorry, I had a little mental blank there. Runner's knee. Now, what that is strictly the runner himself or herself has pain right on the top part. Sorry, I got to be careful here. I'm trying to make a impression of a stork, but which is fine. But there's a pool right there, and I don't want to fall into it. So anyway, you got the runner's knee right here from the thigh bone, the femur bone, compressing directly onto the kneecap. That kneecap itself gets stressed, and therefore you have pain pretty much on the top part of your knee, and hence runner's knee. And what happens there is the reason you've got that type of injury is because you're running on uneven terrain. So the femur, the thigh bone, has to turn inward. When it turns inward, it actually compresses on the kneecap, and that's where you have the pain. That's where it originates from. The third most common running injury that you can experience is something called shin splints. Okay, now shin splints is a little bit of a funny name, but what it is think of the bone with the saran wrap around it. Then think of muscle layers on top of the saran wrap. Okay, with any excess stress or any excess pain, what happens to the leg is that the muscle pulls off the saran wrap, which is attached to the bone, and that causes pain. That can occur when you're running, when you're sitting down, because it's just so painful all the time. It feels like a broken leg. And the reason runners experience this pain is because they haven't either stretched out properly before they started running, or if they're new to running, or if they have stopped running and resumed running, and they haven't, and those muscles in that area are still weak. So what you've got is the soleus and the posterior tibialis muscles, which are usually the muscles involved with shin splints. Those muscles themselves pull up against the bone, rip off that saran wrap, which is called periosteum actually, and then that causes that type of pain. Okay, number 4, you have Achilles tendonitis. The Achilles tendon is actually the main tendon on the back part of your heel bone, which is right here, right on the back there. And what happens is that with running excessively, running uphill, the calf muscle, the back part of your leg, lower leg, tends to shorten, contract, and it tends to pull the Achilles tendon. The Achilles tendon gets a little bit stressed, and that's where you can have swelling and pain when you're running. And so uphill running is what usually is the cause of the Achilles tendonitis. But it can be due to overpronation too, which we'll talk about later. But just for now, remember that Achilles tendon is the one that gets stressed in the back part of your heel, and that's what we call Achilles tendonitis. All right. Number 5 is good old plantar fasciitis. Now you have probably heard of plantar fasciitis. A lot of people suffer from that. Non-runners suffer from that. Anybody who's on their feet a lot will develop, can develop plantar fasciitis. Now, what the plantar fascia is a thin yet strong strip of ligament, of soft tissue that actually is attached to the bottom part of your heel on both feet, of course. And one of them either will be taking a lot of excess pressure and just can't absorb all of that stress, and it'll tend to rip away either from the bone that it's attached to or from itself. So it'll be like this and then eventually have some micro tears to it, which can cause pain. And from that, you can have plantar fasciitis. And plantar fasciitis can occur in non-runners too, but when it occurs in runners, it's usually due to weak muscles, overpronation, or overexertion when you're running. So those are the 5 things that I'd like for you to be aware of in terms of running injuries. IT band syndrome, you've got runner's knee, you've got shin splints, you've got Achilles tendonitis, and then you've got plantar fasciitis. And in the next several videos that I'm going to do, we're going to talk about how to stretch them and how to help heal those injured muscles. All right? EdmontonFootDoctor.com. This is Dr. Shahryar Chowdhury from the Foot and Ankle Wellness Center, and I want to wish you a very nice day and do a random act of kindness for somebody. That's what's making the world go round, and that's what's going to help make this a better world for all of us. Thank you so much, and I'll see you soon. Bye-bye.